Hi everyone, my name is Dr. David Kulla. Today we're here to talk about Osgood-Schlatter's disease. So it's a common disease that we see with growing adolescents. You know, when your bones are still growing, the growth plates are growing, it's common to see this with kids that are athletic, and typically affects the muscles, tendons, and the bones. And right here we have Priscilla here with Osgood-Schlatter's. She's obviously no longer a teen right now, and it does sometimes bother her. So we've given her orthotics for her feet to balance that out, to take some of the stress off. But this doesn't just have to happen to teens that are athletes. It can also happen to sedentary, non-athletic teens. And typically, if your kid is not athletic and not involved in a lot of jumping or running sports, then you're going to see that it's probably coming from something else, that extra stress. It could be extra weight. It could be also flat feet. And I've done some videos on flat feet and how to get the feet assessed. Done so many videos on that, from exercises to how to assess the feet. So we did have to get her orthotics. Were you an athlete when you were younger? Running and jumping sports?
Yes.
Yeah? Okay. So again, it's when you're growing, those years like 13 to 16, a little bit older for boys, but that's typically when we see it. And some of the symptoms are going to be pain, swelling when you kneel, or just with walking or going up and down stairs. And what happens is the pain is right here. And if we go ahead and zoom in to this spot right here, we can see this little tubercle, this little bump right here. Okay, and right here I'm treating her knee, by the way, with laser. We'll go over that in a second. So this little bump right here is where the tendon underneath the patella, the kneecap, attaches. And that tibial bone runs down here on the inside of your leg and shin here, and then stops right about here at the ankle. So a lot can be done. The tibial bone can be adjusted, but also, more importantly, it could be an issue with the ankle or flat feet or both, okay, or a multitude of things. Just depends on what kind of athlete they were, what kind of injuries they had. So some of the things you can do to treat it are NSAIDs, so ibuprofen, naproxen, Advil, aspirin, over-the-counter stuff, or you can ice it a lot, several times throughout the day, and also do some physical therapy or see a chiropractor for some stretches and exercises. If it's still bothering you though, this is a great way to reduce that inflammation locally, and it's called cold laser therapy. And as you can see, we're putting it right over the tubercle, and this helps her immensely with swelling or pain if she aggravates it, or sometimes like hiking or mountain climbing and hiking trails up and down. After a while, this will affect her knee, and this is a great way to do that. But also, I always recommend, before doing any kind of exercise like that, if you have Osgood-Schlatter's, that you do stretches and exercises. But this really helps to reduce the inflammation in and around the tibial tubercle and the infrapatellar tendon and anywhere you need to, and even sometimes behind the knee. And sometimes you may get really tight quads or tight hamstrings, tight front and back of the thigh. So I'm gonna give you some of my favorite stretches and exercises for Osgood-Schlatter's disease. Thanks for tuning in. Appreciate you. If you have any questions or comments, make sure to comment below. And don't forget to hit that like button and subscribe. Thanks again.
Stand up straight next to a wall or supporting surface. Take a large step backwards with your affected leg. Keep your back heel slightly off the ground with the knee soft. Slowly lower your back knee towards the ground while pushing your pelvis forwards. Keep your body upright. You should feel the stretch at the front of the back hip. Hold this position. Sit in an upright position. Bend the affected knee over a small towel. 1. Start by placing the rigid tape on the inside of the leg below the kneecap and just above the bony prominence. Tibial tuberosity. 2. Without tension, bring the tape across the front of the leg and around the back just below the knee joint line. 3. For the second layer, begin to twist the tape to create a rope-like structure. 4. Apply tension as you bring your twisted tape across the front of the knee. 5. Without tension, bring the tape around the back of the knee. Repeat steps 3 to 5 twice more so you have 3 twisted layers across the front. 6. Cover the twisted tape with a final layer of tape to finish. If you have any reaction to the tape including redness or itching, then remove the tape immediately. Stand up straight, close to a wall or supportive surface. Bend your knee on the affected leg, taking your heel towards your buttock. Hold onto the top of your foot with your hand, and gently pull your heel closer in towards your buttock, until you feel a stretch in the front of your thigh. Ensure you keep your knees together. Hold this position. Stand up straight. Place your affected foot forwards with your foot flat on the floor. Keep your back foot facing forwards and soften the knee. Make sure the hips are square while you maintain a straight back. Gently lean forwards and push your hips out behind you. You feel this stretch down the back of your thigh. Hold this position.